Last month, the Program for Improving Mental Health Care presented its findings to world financial leaders in Washington. The research shows that it is possible to narrow the treatment gap for mental health care in low and middle income countries. Now, to further the discussion, we are joined in studio, in our Cape Town studio that is, by Sumaiyah Docrat, a health economist at emerging mental health systems in low and middle income countries. A very good morning to you and welcome.
Good morning. Thank you so much for having me.
Sumaiyah, let's start off with that critical report that shows that it's possible to narrow the treatment gap for mental health care in low and middle income countries. How is that possible?
Well, I think this report and a milestone meeting that took place in Washington, where a number of our colleagues from UCT and around the world, pioneers in this global mental health movement, attended a meeting that was hosted by the World Bank and the WHO. And I think for the first time, it truly spoke to the role that mental health can play in development. We believe mental health should be seen as more than just a health sector issue. It is a development issue. If you look at the costs associated in South Africa to one adult living with anxiety or depression, it's approximately $4,798 per year. So it represents an annual cost of $3.6 billion a year to the economy. And in treating mental illness, you actually are able to improve the productivity of those affected by these disorders and actually lead to a much more productive country, household, society. So I think it's definitely achievable, particularly when you look at it from a development and a health perspective and address it as such.
So how would a country like ours reduce that cost that you mentioned, round about 3.6 billion rand per year?
Well, I think largely that cost is associated with a lack of access to treatment, in providing services at lower levels of care, being able to train primary care providers to be able to deliver psychosocial therapies and prescribe basic depression and anxiety medication would have a huge impact in terms of the ability for all South Africans to actually access the services. I think another problem that we face in our country is, not necessarily just the cost of being at a facility and getting the treatment, but also costs around traveling to facilities. So we really need to work on the health systems aspects that are limiting our people from accessing the treatments they need.
Mm-hmm. Now, from your experience, Sumaiyah, and your point of view, how would you describe the current provision of mental health services in South Africa? Is it adequate?
I think, if you talk relatively speaking, so we inherited a lot of historical challenges. Our colonial health system was characterized by tertiary specialized care facilities where people with mental illness were institutionalized, and now we're trying to shift this model of care so that people are able to access it at lower levels when perhaps their symptoms aren't so severe. And that cost actually represents a much smaller amount to our health system, and it's a much more efficient use of resources. So I think that there's definitely a huge progress occurring in our country, particularly. In 2012, we had a range of mental health summits across all our provinces, and this led to our National Mental Health Framework, which was released in 2013. Our health minister has appointed a ministerial task team that meets very regularly and is really focused on ensuring that the implementation of this national mental health policy comes to fruition as it's designed. So I think from the one side, there's definitely a lot of political will that was really absent in years past. I would say 15 years ago, and perhaps rightly so, our health priorities were dominated by infectious diseases and such as HIV and TB. And I think more and more, not just in South Africa, because we work in a number of low and middle income countries, and we're seeing that slowly policymakers are beginning to realize the role mental health actually has in serving in treating other health conditions. In fact, if you look at those suffering from TB or HIV, you know, their adherence to their medication is often greatly improved once they treat perhaps their anxiety that they're feeling on receiving that diagnosis, or the depression that they perhaps went through when they received the diagnosis. So I think, you know, there is no health without mental health. By treating mental health, we're actually able to improve the outcomes for all health conditions.
What are the impact of the inadequate attention being placed on mental health to countries as a whole, but also to households that are personally affected by this?
So, I mean, there's certainly huge public health and social implications of inadequate access. So, we work in a range of countries in Asia and all over Africa. And we notice, I mean, there's been very evident and shocking human rights abuses that take place because of lack of awareness. A lot of those who suffer from very severe mental disorders are often kept, you know, prisoned at home or in facilities that don't have adequate capacity to treat these patients. But I think if you look a little bit broader, a lot of the discussion with mental health has always focused, and even in this discussion around violent behavior, etc., has focused on severe mental disorder. And really what's been missing in this dialogue is talking about the impact of common mental disorders like depression and anxieties. And they actually have a huge impact to our you know, GDP as a country, to our productivity rates as a whole. For me personally, it's one of my personal interests to look at the actual household impacts of mental illness, and we're doing some household survey work in the Northwest province at the moment, looking at households that live with a household member that has a mental illness, and comparing them with households that don't have a member that have a mental illness. And what you start to see is households that have even one person with a common mental disorder will often have to relent on some of their basic needs as a family, such as education or something as simple as having 3 meals a day, in order to afford that one ill family member to be able to go to their facility, take a day off work, access their treatment, and come home. That's where people are accessing care. In the case where you're living with a household member that has a mental illness and there's no access to care, oftentimes it means that the breadwinner will have to stay at home and look at and provide care to this individual, and children are being pulled out of school so that they can care for, you know, generate an income for the family. And so it really poses huge threats to the entire livelihood of the household at present and for the future.
So it does have a spiraling effect. Thank you so much for your time and joining us in our Cape Town studio. Sumaiyah Docrat, she's a health economist at emerging mental health systems in low and middle income countries. We're asking you that very important question, and that relates to mental health. And do you think there's a link between untreated, and I must emphasize, untreated mental health and violent crime in our country? It's over to Eben.